So growing up, my mom was a nurse and my father was a nuclear medical technologist. And when they would come home from work, they would always talk about their jobs. And I can tell from their faces how excited they were to go to work every day and the fulfillment and happiness they got from taking care of patients. And I said, I want to do that. I want to be able to go to work every day and be happy when I come home and not feel so overwhelmed or tired from a day at work. And so I thought, well, if I'm going to go in the medical field, why not shoot to the top and become a doctor? And so that's what I started to get into. I actually went to a high school that had medical type courses like anatomy, and I found that I really enjoyed it, so I said, okay, I'll stay on this path. At the same time, I was very interested in dance. I grew up dancing ballet, modern jazz, and then I picked up on African hip-hop, ballroom, and I loved that as well. And so as I was growing up, I was talking to my mom, and I said, I don't know, do I want to be a dancer? Do I want to be a doctor? She says, you can do both. You know, dancers, not everybody makes it. She was very real with me. She's not everybody makes it. And you want to have something to fall back on just in case. And so I said, okay, I'll pursue both. And so I actually made sure that I applied to colleges that had a really good dance program as well as a really good pre-medical program. So I was able to do both all the way through college. And then once I got to medical school, I kept on dancing recreationally, just as a stress relief. And so now my passion is taking care of dancers because I'm intimately aware of the kind of injuries and struggles that you can go through as a dancer, both physically and mentally. And I want to be able to give back to that community and help them continue to do what they love. Because I was interested in both dance and medicine, I thought, well, I can marry the two together and specialize in musculoskeletal injuries. That way I can help patients like dancers and other athletes get back to doing the activities that they like to do. And so initially, I decided to pursue orthopedic surgery, but then when I shadowed one of the orthopedic surgeons, I said, well, this is great. I love clinic. Don't really like the surgery part as much. And the orthopedic surgeon said, well, you know what? You might like PM&R, physical medicine and rehabilitation, because that's pretty much what they do. They don't do the surgery part, but they do all the clinical sports medicine, musculoskeletal injury management part. And I said, I have never heard of that specialty before. And frankly, a lot of people still haven't heard of that specialty. So part of my goal is to improve awareness of it. But because of that orthopedic surgeon, I was able to look a little bit more into it, and then I shadowed some physiatrists, and I found, yes, this is what I want to do. And so when it came time to apply to medical school, actually, because this was even before medical school, I already had a plan. And so going through medical school, I made sure that I took all the courses that would make me a good applicant when I applied for residency in physical medicine rehabilitation. And then got into my first choice residency program. And then from there, I learned that I could further subspecialize in sports medicine. I said, this is great. So then I can further pursue my dream and then hone my skill set. And so that's what I did. My favorite part is exactly what I was hoping I would get out of my job. When I come home at the end of the day, I feel fulfilled, like I really made a difference in people's lives, improving their quality of life, improving their function, from something as simple as, yes, you can walk again now that your fracture is better, or wow, now you're able to perform again fully on stage. All those things, you know, seeing patients looking so happy, having gone through the course of treatment that we had worked together as a partner, as a team, because, you know, I work closely with the therapist as well. That is so fulfilling.